Hi, this is my review of the muscles of the foot. So the plantar side of the foot, the sole, has 4 layers of muscles. The first layer has the abductor hallucis, the flexor digitorum brevis, and abductor digiti minimi. The second layer has the quadratus plantae and the lumbricals. The third layer has the flexor hallucis brevis, the adductor hallucis, and the flexor digit minimi brevis, while the fourth layer has the plantar interossi and the dorsal interossi. The main nerves that innervate the muscles of the foot are the medial plantar nerve that innervates the medial muscles of the foot, and the lateral plantar nerve, which innervates the lateral muscles of the foot. The main functions of the muscles here are to abduct and adduct the toes, as well as to flex the toes. For the toes, abduction means moving away from the second toe, because the second toe is considered the middle of the foot. While for the second toe itself, moving in either direction is considered abduction, while adduction is opposite, so moving towards the second toe. Some of the muscles also flex the toes because they are on the plantar side of the foot, so they will flex the toes. And one special muscle is the lumbricals. They will prevent clawed toe during walking or during your gait, and I will explain later on. But for most people, the fine control of individual toes is not important, so the muscles of the foot are mainly for fixing the foot in place to support the arches of the foot or to maintain balance. On the medial side of the first layer, we have the abductor hallucis. Proximally, this attaches to the calcaneus, more specifically the medial process of the calcaneal tuberosity. It also attaches to the flexor retinaculum, which is a fibrous band that holds the muscle tendons in place. And why is this important? Because if the muscle tendons are loose, then they won't be able to perform their action as efficiently, leading to a phenomenon, I think it's called bowstring or something. And lastly, it also attaches to the plantar aponeurosis, which is a thick band of connective tissue on the plantar side of the foot. And then distally, it comes up here and attaches to the base of the proximal phalanx of the big toe, the medial aspect, so on the side. It is innervated by the medial plantar nerve, and from how the muscle is attached, we can see that, and also the name of the muscle, the abductor hallucis, abducts and also flexes the big toe. So next here, we have the flexor digitorum brevis. And one thing to note is that for my previous video, the muscles of the lower leg, usually the brevis is located more deep to the longest equivalent, but in this case the flexor digitorum brevis is located more superficially compared to the flexor digitorum longus, which is in the second layer of the foot. So the flexor digitorum brevis attaches again to the medial process of the calcaneal tuberosity, and also to the plantar aponeurosis. And then it runs up distally to attach to the middle phalanges of the 4 toes. And one thing to note is that it attaches to, they have 2 attachments per phalanx, and 1 to the medial side and 1 to the lateral side. So in total, there are 8 distal attachments for the flexor digitorum brevis. It is innervated by the medial plantar nerve, and it flexes the 4 toes because it is attached to the plantar side of under the toes. And lastly, we have the abductor digiti minimi. So this is the equivalent of the abductor hallucis for the pinky toe. It attaches to the medial and lateral tubercles of the calcaneus, and also the plantar aponeurosis. And then distally, it comes up and attaches to the base of the proximal phalanx of the 5th digit to the lateral side. It is innervated by the lateral plantar nerve, and then its action is to abduct and flex the pinky toe because it is attached to the lateral side of the 5th digit's proximal phalanx. we have two muscles on the second layer of the plantar side of the foot, and both of these muscles are related to the flexor digitorum longus. This flexor digitorum longus is a muscle in the deep posterior compartment of the lower leg. So the first muscle we have here is the quadratus plantae. It attaches, it has two heads, and its medial head attaches to the medial plantar surface of the calcaneus, while the lateral head attaches to the lateral plantar surface of the calcaneus. And then distally, it attaches to the tendon of the flexor digitorum longus. So it kind of ends halfway through the foot. In other words, it attaches posteriorly to the tendons of the flexor digitorum longus. The quadratus plantae is innervated by the medial plantar nerve, and it assists in flexing the four toes because it is attached to the flexor digitorum longus. Next, we have the lumbricals. So the lumbricals are four small muscles, 1, 2, 3, and 4, and they are proximally attached to the tendon of the flexor digitorum longus on the medial side. And then distally, they attach to the base of the proximal phalanges of the four digits. The most medial lumbrical is innervated by the medial plantar nerve, while the lateral three lumbricals are innervated by the lateral plantar nerve. And the action of the lumbricals is that it flexes the proximal phalanges at the metatarsal phalangeal joint, so where the metatarsal and the phalanx bone meets. But another unique thing about the lumbrical is that it extends the middle and distal phalanges of the four digits at the interphalangeal joints, so between the phalanx bones right here. And why is this the case? Because the distal attachment of the lumbricals actually goes beyond this point due to the connective tissues in this area. And so for all the other muscles in the plantar side of the foot, you would expect both the metatarsal phalangeal joint and the interphalangeal joints to flex at the same time. But for the lumbricals only, when the metatarsal phalangeal joint flexes, the interphalangeal joints are extended instead because of this connective tissue. And why does it extend? Because the connective tissue actually runs, I'm not sure how, but it runs over to the dorsal side of the foot, which is how it can extend the toes, because you have to be the attachment point has to be on the top of the toes in order to extend the toes. And this is important for preventing your toes from clawing when walking. So for the third layer of the plantar muscles of the foot, we first have the flexor hallucis brevis. Proximally, this has two attachments to the plantar surface of the cuboid and the plantar surface of the lateral cuneiform. And then it runs distally to attach to the medial and lateral side of the proximal phalanx of the big toe. It is innervated by the medial plantar nerve, and its action is to flex the big toe. You can kind of guess this from the name of the muscle as well, the flexor hallucis brevis. So the next muscle we have is the adductor hallucis. This muscle has two heads. So the first head is the oblique head, and this runs more diagonally or more anteriorly and posteriorly. For the oblique head of the adductor hallucis, it attaches proximally to the bases of the metatarsals 2 to 4. So this is metatarsal, so 2, 3, and 4. And then for the transverse head of the adductor hallucis, it attaches to the plantar ligaments, so the ligaments on the bottom of the metatarsophalangeal joints, which are the joints right here. And both the transverse head and the oblique head of the adductor hallucis attach to the lateral side of the proximal phalanx of the big toe. They are both innervated by the lateral plantar nerve, the deep branch, and the action of the adductor hallucis is to adduct the big toe, and also to assist the transverse arch of the foot, which runs left to right. Lastly, we have the flexor digiti minimi brevis. Proximally, this is attached to the base of the fifth metatarsal, and then it runs distally and attaches to the base of the proximal phalanx of the fifth digit. It is innervated by the lateral plantar nerve, the superficial branch, and it assists in flexing the pinky toe. For the fourth and most deep layer of the plantar muscles of the foot, we first have the plantar interossi. There are 3 muscles here, and proximally they attach to the plantar medial aspect of the shaft of the metatarsals 3 to 5. So what that means is that they attach to the bottom and medial side of the 3rd and to 5th metatarsals. So you can see they're kind of between the metatarsal bones right here. And then distally they attach to the medial side of the base of the phalanges 3 to 5, so 3, 4, 5. They are innervated by the lateral plantar nerve, and their action is to adduct the digits because they attach medially. And the plantar interossi also help flex the metatarsal phalangeal joints, since they cross the metatarsal phalangeal joint here on the plantar side. And the next muscle we have in the 4th layer is the dorsal interossi muscles. So these are also between the metatarsal bones, but more dorsally compared to the plantar interossi here. So the dorsal interossi have 4 muscles instead of the 3 in the plantar interossi, and they attach proximally adjacent to the shafts of the metatarsals 1 to 5. So basically at this point 1, 2, 3, and 4. And there are 4 dorsal interossi muscles because there are even though there are 5 metatarsal bones, there are only 4 gaps for them to fill to be in. And then distally they attach the first dorsal interossi muscle attaches medially to the 2nd digit, to the proximal phalanx, while the 2nd to 4th dorsal interossi all attach to the lateral side of the 2nd to 4th digit, so 2nd, 3rd, and 4th. So I'll repeat that again. The dorsal interossi, the first muscle, attaches medially to the 2nd digit, the proximal phalanx, while the other dorsal interossi muscles attach laterally to the 2nd to 4th digit, their proximal phalanx. The dorsal interossi is also innervated by the lateral plantar nerve, and its action is to abduct the digits since they are attached laterally, so they will pull the toes and spread them apart. And similar to the plantar interossi, they also help with flexing the metatarsophalangeal joints here, since they cross the joint on the plantar side. For the muscles on the dorsum of the foot, so on top of the foot, but deeper to the muscles of the lower leg, we have the extensor digitorum brevis here. It attaches proximally to the dorsal lateral aspect of the calcaneus, and then distally it extends and attaches to the extensor tendons of toes 2 to 4, so the medial digits. It is innervated by the deep fibular nerve, and what it does is it assists the extensor digitorum longus in extending the 4 toes. Next to it we have the extensor hallucis brevis. It attaches to the same area proximally to the dorsal lateral aspect of the calcaneus, and then distally attaches to the base of the big toe to the proximal phalanx on the dorsal side. It is also innervated by the deep fibular nerve, and it assists the extensor hallucis longus in extending the big toe.